Now, the round 2 of the vaccination mega nationwide vaccine dry run has begun. The vaccine dry run has begun in some parts of the country. It will be carried out in 736 districts across of India. This comes ahead of the government's mega vaccine rollout plan. Union Health Minister Dr. Vardhan is in Chennai now to review the dry run. In fact, the Health Minister thanked all the frontline government workers and officials there who've committed to this drive. He added that the government has ensured every detail regarding vaccination is conveyed to the people from the national level all the way to grassroots. The trials will be an end-to-end testing of actual vaccination process. It includes planning, preparations, including pre-requisition of vaccine introduction. The dry run will also test the process of uploading beneficiaries and session site details into CoWIN app, which is a designated app given by the government. Verification of documents at the session sites will be carried out. Beneficiary of, in fact, a mock drill of the beneficiary vaccination and reporting. All of that will be checked.
I think we need to salute our coronavirus. We need to salute our scientists. We need to salute the leadership of our Prime Minister Narendra Modi ji, who has inspired everybody, cutting across anything, across all spectrums. And we also need to salute all these journalists whom I have always considered as corona warriors, because they were the ones who were omnipresent. They were present everywhere. They were reporting and working at ground zero. And I know the ground zero was a very, very risky.
Today I chose to be in the southernmost part of India, in one of the southern states, Tamil Nadu. And I can only say with conviction, and I would like to place on record my sincere most appreciation for the good work that has been done by Tamil Nadu. Our Health Minister, with the blessings of the Chief Minister, and with dynamic officers like the Present Health Secretary and all his colleagues here in the government sector as well as in the private sector.
Now, cutting across to our reporters, bringing us all the ground reports on the length and breadth of the country over vaccination dry run. Let's listen in.
What we can see here is that already the participants who will be in the dry run are made to sit in an orderly fashion here, and this is a procedure that the state government will be following once the entire procedure starts as well. What we're being told here is that this dry run will help officials to identify the kind of issues that are there in the format which is going to be followed. Initially, there will be the COVID app which will be used to assist in the entire procedure. The name list of the candidates who will be coming for getting the vaccination will be called in, and they will be made to sit in this orderly fashion. What you can see here, I have with me a couple of doctors who are also going to be participating. Sir, can you tell us, like, what are the things that every participant should be thinking about when they're coming for this procedure?
I don't think there is there should not be any fear among the people. First thing, it's a new hope that we are getting a vaccine now. We have to, people have to accept the fact that we have a vaccine now. And first thing is that people should get rid of their fear, because even we medical professionals are having this vaccine now. So I don't think there's going to be any problem.
It is a very tough situation. It is a monitoring situation even for those involved in this vaccination process, and we'll have to wait and watch as to what will be the changes that will be brought about by the officials on that particular day when the vaccination actually starts. With camera person Daniel from Chennai, this is Akshana for India Today.
Well, the second dry run is taking place not just in Karnataka but across the nation. Now in Karnataka, unlike the first dry run where 5 districts were selected and each district had 3 locations each, this time around all the districts and 7 locations in each of the districts. So in Bengaluru, we are now at a private hospital, which is the Aster CMI hospital. We have with us the Chief of Medical Services, Dr. Shugato, to explain more as to what's happening over here. Doctor, I believe that this is the first time that your hospital is taking part in this dry run. What's really happening over here, if you can just explain to us?
True. So this is the one of our, we are very honored to be one of the chosen few hospitals to be taking part in this vaccination drive, which is actually the war against COVID. We have been fighting this war against COVID for the last, almost 8 months, and now the time has come to really win over it. And as we all know, that this vaccination drive, it is being across the country, it is happening in Karnataka, now it has arrived. And over here, we have so many vials of vaccines that are coming from the government side. We are really thankful to the government. And as we go ahead here, we are the chosen hospital for the dry run here. There is a space with social distancing that has been kept here, if you observe here, where every patient after their vaccination will be sitting here based on the numbering that has been given with the serial numbers, and that the 2 rooms are there in case they fall, have any kind of symptoms and all. They can lie down here in the kind of bed that we have here, the patient beds. Similarly, we have another one over there. Please come. Okay.
Well, in fact, doctors showing us exactly what will happen once they are vaccinated. Yes, you were saying that basically these are observation places where after the patient is vaccinated, they'll actually wait, and that's what's written over here. It's an observation room. Yes, doctor, you were telling us?
Exactly. So these are 2 rooms where in case there is any symptoms, they can brought here. They'll be checked over here for the initial assessment in terms of in case of what kind of symptoms, the vitals, all that will be taken here. We have the defib over there in case there is any reaction for which we need to give a proper kind of crash cart requirements. We have a crash cart there. All the emergency medications are there stocked in terms of the requirements. And from here, then again, as the other patients will be waiting here for half an hour, and any kind of, this thing, after that, they will exit from here.
Doctor, now the Health Minister, Dr. Sudhakar, had come over here. He spoke to you all. What did he talk about the procedure kept in place? Okay, we'll speak to Shreya. Sure. So, as head of the operations over here, what did the Health Minister tell you? Was he satisfied with the preparations, everything put in place?
Yeah, he seems to be very happy with whatever we've done. Probably he just said that since it's a health staff that we're vaccinating, so there are about 1,300 staff that we've got here. So for them, we need to increase more of the observation area and vaccination rooms because they want to complete this entire drive in about 2 days. Yeah, in 2 days. So they want to complete vaccinating all the staff within 2 days. So we need to just probably increase the area. But otherwise, I think he is quite happy with whatever we've done.
Thank you very much. Thank you, Doctor. So this is the second drive which is going on over here, not just in Bengaluru, but across the state. It looks like the state of Karnataka, all the hospitals, be it private, public, your district hospitals, your taluk hospitals, as of now, have worked on all there or present in the armor and are ready when the vaccine vials finally reach the state. And the doctors, basically both from the public and the private sector, will be vaccinated. With video journalist Madhuar, Nolan Pinto for India Today.
Across all the districts in Maharashtra and the municipal corporations, there is a vaccination dry run that has been put in place by the Maharashtra government. I'm joined by Dr. Rajesh Dere, who is the Dean of the COVID Center here in BKC in Mumbai, where the dry run is going to happen. Let's speak to him. So what exactly, this used to be a jumbo COVID cure center. People who had COVID used to come here. Now it has been turned into a vaccine center.
Now, for your information, BKC was a jumbo COVID center. That wards are separate from this. This hangar was only for doctors. There was no patient admitted here. And these doctor hangars, we have converted into vaccination centers. Now, as of now, today we are supposed to have a dry run.
Can I ask you, what's exactly a dry run? Why are you doing it?
It's just like a mock drill. First of all, it is done to see whether whatever training we have given to our healthcare workers, whether they can practically implement on the ground. So that faith they will develop in that mind, that whatever training given by municipal corporation is adequate enough to do it practically.
The nationwide dry run of COVID vaccine is underway here at Kolkata's premier medical facility, the SSKM hospital. We are here at the facility. First, of course, there will be the registration of those people, the beneficiaries who will be undertaking the vaccine. And then, we'll show you the vaccination room. This, of course, is the makeshift vaccination room where the entire process is taking place. There are trained medical officers who are going through the training that's happening today. We can see a box that has been kept, and I believe that here is where the vaccine will be kept. Didi, ekhani to vaccine ta rakha hoche. So here is where the vaccine is being kept in proper temperature, and then each and everyone who is coming here, we are told that there will be 25 beneficiaries today who will be undergoing this mock drill. So they are being provided with this vaccine, not the actual vaccine of course, but the health workers are going through that entire drill, and once the vaccine has been administered on a beneficiary, the vaccination process is done, then that person would be brought here in the observation room. So this is the observation room, and we will try and show you how people here are being kept in observation. So in this auditorium, they will be made to sit for about 30 minutes. All those who have gone through the vaccination process, and doctors will be monitoring their health. So very simple procedure: registration, vaccination and observation, following which a person who has undertaken the vaccine will be allowed to go home.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.